Hi, I'm Dr. H. I'm going to give you an update, a 24-hour update as compared to yesterday. It's now Wednesday afternoon, 4 o'clock Pacific time. It's been about 26 hours since I last spoke to you guys, and a lot has changed. So I wanted to give everyone an update in my own views as to where we are today versus yesterday, and sort of give an overview of the big picture. The big picture in the United States is driven by the data from New York State. Right now, New York is sort of ground zero for the United States. I think I'm looking at the data here. The mortality rates are doubling every 2 days in New York. In contrast, other states around the nation, which I'll describe in a minute, are not seeing anywhere close to that level of exponential growth, as the epidemiologists call it. In contrast, sitting in San Francisco, where I know some of you know I practice, San Francisco has remained relatively flat in both in case numbers as well as mortality for the last 10 days or so. And the question is, why? The data from LA are unclear because it's a very large city and it's just too early to tell. But in San Francisco versus in New York, for example, there are multiple differences. The first one is that we in the Bay Area practiced social distancing relatively early, somewhere between 4 to 7 days before they did so in New York City. Perhaps the other very important issue is the density of people. The Bay Area has a much less dense population as compared to New York, and San Francisco proper, I think, only has 1 million or so people versus the 8.5 million folks in New York. So the density plays a big role. And then the last unknown is whether the virus itself, the virus coming largely from Europe, more likely in terms of mutations and so on, may be different in the East Coast versus the West Coast, and particularly in New York. So right now, New York State roughly has 1/2 of the U.S. cases, and that's because New York State is doing an overwhelmingly better job at testing, but it also has around 1/3 of the mortality. And again, the mortality is still in an exponential phase and will certainly get worse before it gets better, given the number of patients that are now being seen in the intensive care units throughout New York City. When you look at the data from the US, it's intriguing because the majority of cases are coming, of the new cases over the last 24 hours are coming from 6 states. And I think that's 80% of all new mortality occurs in 6 states, and 90% occur in 9 states, and 5 of them are on the East Coast, driven by New York and New Jersey and Connecticut largely. And then in the West Coast, there are 2 states, Washington and California, which drive. And then right now we have, in the South, we have Louisiana, which is coming up, and we just don't have enough data yet from Florida and from Illinois. So largely, there are pockets to worry about and to watch and to observe over the next 72 to 96 hours. But I understand what the president is saying in terms of regions. And again, right now, our ground zero, and our hearts go out to all the New Yorkers that are suffering, takes place in New York State and in New York City proper, as well as the outliers from New Jersey and Connecticut. When you look at the national data, again, about half the states, 24 out of 50 states, have no new deaths over the last 24 hours. 24 of the 50 states have less than 2 deaths, and then the majority of the states, 35 out of the 50 states, have less than 10 new deaths total, 10 deaths total. So again, we have to concern ourselves with overwhelming our ICU beds, particularly in New York City, because the average critical care hospitalization is taking over 10 days. But in most parts of the country at this particular moment in time, as we all practice social distancing, it appears that we may avoid the overwhelm on a national level. When you look at the data globally, we as a country are still doubling every 2 days, again driven by what's going on in New York. And the same is happening in Germany, Spain, and France. The United Kingdom is a little bit slower, but the good news is that in Italy, which is the most advanced in terms of the epidemic, they're no longer doubling every 2 days. So as they did 3-4 weeks ago, where they were where we are now in the United States, they're now doubling on a weekly level rather than on an every 2 day level. So what is the sort of the big picture here? I think right now, the earlier we do social distancing, the better. We know that it works. We know that that suppression is not just social distancing, but it is active surveillance and active testing. And we in the United States don't really have this ability at this time. For example, a patient that is asymptomatic cannot get tested properly in San Francisco area. I know that for certain. I think that not only hand washing is fundamental, but also I believe that wearing gloves when outdoors it may be fundamental. Understanding that it may you have to care for your gloves as well as you would care for your hands. The most important mystery here is whether or not the therapy hydroxychloroquine or Plaquenil will make a big difference along with the azithromycin or the Zithromax. There are many shipments. There's a large shipment going on to New York. We know that, and that experiment will be run there. And in my next post, I'll give you the story that I have, my own personal experience with the use of this drug in my own population here of symptomatic patients who are at high risk and so on. So I'll be back tomorrow with more on treatment options and more on the update as we have nationally. Take care. Bye-bye.